to see how they, because we could even do through them.
Okay.
Might be better.
I haven't, I'm going to give them their POs a couple days.
Uh-huh.
But yeah, that would be great. I haven't got a contract from them either.
Okay, let me give him a call and see, because we could probably do something together.
Okay. Linda, what is your occupation here, and what do you do?
I'm the Violence Prevention Coordinator for Multnomah County Health Department.
Okay. Why is youth violence a public health issue? And if you could pause and then respond by saying, youth violence is a public health issue because of blah, blah, blah.
Well, we see youth violence as a public health issue because, well, the ramifications of violence that affects the entire community is affecting youth at a greater degree in these times. The thing that we're seeing is a higher number of youth involved in more violent crime. Crime in and of itself nationally, or crime reports, have actually decreased in the last few years. However, crimes are more violent, they're more violent in nature, and perpetrators and victims of crimes are getting younger. And so it has become an issue that we need to deal with in order to be supportive and save the value of our priority, which is our children and youth.
Why are these times of the violence that young people experience in these times different from the violence young people experienced when you and I were their age?
I'd say that the reason that it's different, that violence is different in these times, there's many reasons. That's one of the issues that public health looks at in terms of all of the issues, all of the implications, and all of the contributors to violence. But as we've begun to realize in terms of our research, both nationally and locally, that violence is more serious now primarily because of the kinds of weapons that are being used. When you and I were at this age level, there was certainly some conflict, and there were some issues that youth were dealing with at the time. And yes, there were serious injuries and homicides and suicides in our time as well. No question about that. However, there is a higher level of access to weapons, serious weapons, including guns. And secondly, conflicts and the managing of conflicts becomes a serious, I think, a serious threat to life because of the use of those weapons. The difference between fists and guns, because of guns being much more fatal and terminal, final in nature, and the access to them.
When you look at violence, we think of just the gun violence. What types of violence do you look at in terms of the public health issue?
Public health, in our approach, we're looking at all forms of violence. We're looking at, we name violence by interpersonal and self-directed violence or self-directed injury.
What's that mean?
It's suicide. Suicide attempts and suicide completions. But interpersonal violence includes assaults that we've seen, child abuse, elder abuse, domestic violence is a serious issue, and we're trying to take a look at all the levels of assault that we see, and assaults of one person to another. One of the things that we have not actually done enormous amount of research on is property crime. There is it's a real high level and prevalence of property crime as well. But what we're really looking at is the injury rates and the kinds of interpersonal violence that we're seeing in our communities in Multnomah County. That's the difference in terms of, that's one thing. But public health's responsibility in general is to address the issues and needs of all communities as they're threatened, their health is threatened. Okay? So when somebody's health is threatened, that means that either it could be in all kinds of forms. It could be in a form of inadequate food. It could be in the form of inadequate health care. It could be in inadequate housing. It could be a number of things. So we see poverty as a threat to public health, and just as we see smallpox as a threat to public health, because it does tear at the fabric of a community.
So how will the health department deal with it, given that poverty is one of the underlying reasons? Are you going to go out and create new jobs to deal with the issue?
Well, in terms of the health department's approach, what we're doing and what our job is to take a look at what the issues are and provide the kind of information in this form of a report and as a baseline kind of information piece, so that policymakers and community leaders, as well as the community itself, can start to develop some of their own solutions. And one of those recommendations is, in fact, one of the conclusions that we have drawn is that there needs to be an effective approach to community development. And while we can't, go out and actually do jobs, we can affect policy. We can, in fact, make recommendations to policymakers about those issues. And there are organizations within the county, in the county government, and outside the county government that deal with poverty issues. So we're not in a position really to start a new bureaucracy, if you will, but to utilize the assets that we do have already in our communities to address the issues by this kind of information.
How did poverty, and that's come up quite a bit, how has poverty played in increasing violence? You have no money, how can you afford to buy a gun?
Well, from the information that we have, guns are easy to access. They're not expensive at all. So you can buy a gun for as much as you can buy lunch for in this community. So it's not a major expense. But when we're talking about access to guns, we're also talking about access to guns in our own family homes. And what we're really talking about here in public health is not necessarily gun control. That's not what we're looking at. What we're looking at is gun safety and gun safety responsibility for youth and children, because there's easy access, and what we found is approximately 65% of persons who were assaulted or injured or murdered in Multnomah County over the last 4 years, 65% of those are known to be by persons who know the person. So we know who it is that will injure us in some form or another. It could be a family friend, it could be a relative, it could be a neighbor, but it's someone we know. The other thing is that suicide, especially in young people, most completed suicides are by guns. And so when we look at that, and a large majority of those guns were family guns. So the question is, how can we preserve the right of persons to bear arms, so the constitutional right, while maintaining a sense of safety for kids that have access to those guns, and the nature of what happens, because a suicide attempt with sleeping pills or something like that is just that, an attempt. And most of suicide attempts with a gun weapon are complete or create long-term disability.
How has Multnomah County Health Department, the approach you've used to identify and address the various issues of violence, differ from other jurisdictions, such as if I'm watching this video from in LA or Arkansas, what's different in the way that Multnomah County handled this issue as opposed to other areas?
In the nation?
In the nation.
I'm not sure it is different. I think that many of the communities across the nation have addressed it the same way. There are a number of public health departments that are addressing this issue. I think the differences are more in line with whether we see it as a prevention issue or as an intervention issue. While we support both aspects of that, and juvenile justice really takes a look at intervention, what kind of strategies can they use for protecting youth who are involved in violent acts. In terms of intervention strategies, our approach is like taking a look at prevention to stop it before it happens. And that's one of the issues that we need to take a look at across all departments. So if you were looking at places like Minneapolis or New York City or San Francisco Bay Area, you might find some of the same approaches being used. And our approach, and I think the validity of our approach, is it's multifaceted and it engages the community, because we really believe that communities are the only entity that can make the difference. What is necessary, I think, is a support system for communities to actually resolve their own problems.
Funny you brought that up, because now you're talking about prevention at a time when social service dollars are being restricted and rescinded.
Yeah, well, that's you know, that's part of the struggle, and I think that is part of the challenge. When we have on the one hand more jails being built exponentially in this state and in this country, because the belief right now is that we must incarcerate in order to change the behaviors. I think that there's certainly a number of people in public correction systems that don't believe that. They really believe that prevention is the strategy. But one of the challenges that we face is proving which strategies work, which kinds of things work. And unfortunately, often what we've done is take a look at things much more singularly. And so we look at one issue developed to answer one problem, rather than acknowledging there's several problems and that several solutions have to be utilized. And communities in the best position to tell us what those are.
Let's talk about suicide for a minute. You said that's increased, and because of the self-inflicted weapon of choice, which in this case guns, is much more effective. Why are young people, especially young men, why did that suicide rate rise so much in Multnomah County?
Well, actually, over the last several years, it hasn't risen as much as it has across the state of Oregon. But the state of Oregon is much higher than many other states in the country. And at this point, we don't know why. We don't know all the reasons why. So we really couldn't say why that is happening. But the numbers are showing that younger people, but it is not necessarily prevalent in youth, that are committing suicide. But that is a major issue just by nature of that sense of despair. And we're concerned about that. We're very concerned about that. Our suicide rates, and I'd have to take a look at the report to tell you, but it's not, what we're seeing is it goes across all age lines. And some of the indicators are telling us that it's stress and family issues, family stress issues, mental health issues, substance abuse issues. So there's really a lot to take a look at that. But in terms of age groupings, it's not all very young people. However, it sort of goes across the, and I know your video won't be able to show that, maybe it will, but you see that. It's really going across all age groups.
Well, we've always heard that senior suicide is...
And some of those senior suicides have to do with either terminal illnesses or have to do perhaps with a sense of despair, and also an unwillingness to be a burden on society. And so those are some, but the one thing we are seeing, as you can see in this, is that men commit suicide at a much higher rate than women. Boys and men at a much higher rate than girls and women. And a lot of that is because the majority of men who commit suicide do so with a gun, and women do not. Most, or I shouldn't say most, the sort of the method of choice is different kinds of things like pills or overdoses or asphyxiation, or those kinds of methods which can be interrupted more readily.
Right. How has this overall rise in violence, how has it affected, how do you feel it's affected the communities?
Well, I think it's created in terms of the discussions.
Could you preface your statement by saying...
Oh, sure. The way that violence has affected our communities in the last several years, I'd say probably in the last 5 to 10 years, is that it has created a sense of distrust, higher levels of fear in the communities, and a sense of hopelessness. That is the tension around it. Even though many of the stories and many of the understandings of what's really going on are driven by the media. And some of them are not necessarily completely accurate. So what happens is that when we read a story in the newspaper, for example, any newspaper that we pick up, obviously they do that for a reason, but what really happens is that the story is told in one way, but when we talk about seriousness of violence and that are, you know, the whole community of Multnomah County, for example, is under large degrees of stress due to violence. In comparison to other communities of like size across the country, we do not have the nature and the prevalence of violence as many other cities in the country. Mm-hmm. The other thing is that there is a high level of community involvement in this county, and community neighborhoods have had a long history of involvement. So we have the infrastructure to do that, but it doesn't erase that perception of community that's fearful. And unfortunately, that is a truth, and people's perceptions are their reality, and we must honor that. So that's one of the things I think the highest level is fear. Fear of someone injuring us, a stranger danger. I mean, even children, are taught stranger danger how to protect yourself from strangers. Unfortunately, most acts of violence are done by people who know us. So I think it's time for us to really start to take a look at that reality and talk about how we're affecting, how our families are being affected by domestic violence and by child abuse. And I think those are some critical factors. Over 25% of assaults are domestic violence. That's the largest segment of assault in this county is domestic violence. And that's the way it is all across this country. And yet we really need to start taking a look at that impact of domestic violence on the entire family structure and how it affects child abuse and how it affects youth that later in life get involved in violent acts. Because we're basically a product of our environment. And it is all of our problem. I want to be clear about that. It's not any one community's problem. It is all of ours, because no matter how we do it, even by ignoring it, we're doing something. You know, so that's how I see some of those issues in terms of how the community has been impacted.
Do you guys have any questions?
Yeah.
Not yet? Oh, go ahead.
You do?
Is this right?
What?
Is this map correct? So we're...
Yes.
Okay.
And that's mapped on the basis of addresses out of the police reports.
No kidding?
No.
It's sad.
Yeah.
Okay.
I also have a gun dealer map too.
Rolling.
But it's not in that report.
Raina?
What aspect or what form of violence do you see escalating at a higher rate than others?
Assault. Assault is higher, and domestic violence. Domestic violence is charged as an assault, and that's probably the highest in terms of escalation, and certainly police response. Homicides have stayed about the same. Murders have stayed about the same in the last 5 years.
Do you see any of that are decreasing?
Any of it decreasing?
Mm-hmm. Like at the level, like maybe suicide rates were higher last year than they were now, or?
The one area that I think probably you could probably say even the numbers in murder have stayed the same. Our population has increased. So actually, if you were to say anything, if anything's decreasing, it's number of murder. But the numbers are showing it's staying fairly steady. But you have to understand too that we really have a lot more people now. But I think that it's fair to say that epidemic levels of homicide are serious in the African American community for men 15 to 24 years old. And that's a serious issue, and you and I have talked about that. And the one thing that's really interesting about this is we investigated 62 murders, 62 homicides, and 6 or 7, I can't remember, are gang related. So it's not a lot. It's not very many gang at all.
Then why are African American men disproportionately victims of homicide when only out of 62 murders, only 7 of them were gang-related.
Well, not all African American men are in gangs. So, and not all of the murders are necessarily impacted by that kind of behavior. But the per capita figure is pretty high. There's still quite a few more Caucasian men involved, okay, in murders. But when you figure the percentage of Caucasian people that live in this county, and so what we did was did a comparison to that population. So when we compare the population of Caucasians to the number that are murdered or perpetrators of the crime, the numbers are highest. The raw numbers are highest. But when you compare the per capita, it's much higher in African American men.
The reasons in this study of 62 homicides, were the reasons the same between Caucasian men and African American men for the reasons for homicide when you looked at it in great detail?
Well, pretty close.
Over
The majority of homicides, there were, I think, about 10 to 12 related to domestic violence. That could be clearly domestic violence, either a murder-suicide, or murder committed after an incident of domestic violence. And then you figure the 6 or 7 gang-related. The rest of them, majority were having to do with some form of altercation that was either drug or alcohol related. Like you were saying, a drug deal gone bad. It could have been maybe some guys at a tavern arguing over something, and before you know it, things got to an escalated level, and that actually has happened. One goes out to the car, gets a gun, comes in, shoots somebody. What started out as a fist fight turned into a murder because somebody had a gun.
At any point during the 10-year period that we're focusing on right now,
Mm-hmm.
did you ever see women were women ever committing more crimes than men? Or
Not
were women
in terms of this report, no. We're not seeing that.
So there hasn't been a lot.
Not more than men, no.
Who else?
Okay, I think that you guys don't
Did you have a
they're
question?
new, because like I said, I just threw them into the frying pan. I'll be able to get this on Monday,
You bet.
right?
Mhm.
I want to animate those maps.
Okay, that's how it worked. I'll turn this on. All right.
Okay, do you see an aspect or a form of violence rising higher than it was back in the day?
Yeah, I see levels of assaults, numbers of assaults. And a lot of those have to do with domestic violence.
Has any form decreased?
I would have to say that the one that perhaps you could say has decreased, even though it hasn't, in raw numbers and per capita, but the numbers of people being murdered has stayed about the same, while the population has continued to go up.
All right. Okay. You had 1 or 2 more, or something else. I can't remember what it was.
Do you see women committing more crimes or being the victims of more crimes than men?
What we've seen
Between-
in terms of the data that's in this report in our history that we've gathered is that not in any of the areas are more women committing crimes than men.
That was it.
That was it?
Mhm.
Okay, stay right there.
And it's everywhere. See that one? That's partner abuse.
Oh,
See, it's everywhere.
It's everywhere.
Okay, so you see it. There, you see these
Yeah, what's
shades
this
right
area here?
This is police will go to some area and write a report. Sometimes they won't. Okay, so it really depends on the situation. The other thing that we're looking at is that we know, and I don't know where you all live.
I live in St. John's.
St.
Northeast.
John's.
Back on the John.
Okay. Northeast.
Northeast.
Okay. So would you say, in your estimation, I live in Northeast too, is that we probably have more police coverage in our area than anywhere else in the city?
Well, I mean, yesterday when I can't remember where I was going, but I was walking down the street and it was a van, it was a canine unit, and there was this other car, and I asked this lady, I said, what are they doing? She was like, it's a crack house over there, and I didn't even know it was over there
Right.
because I had never seen the police go over there before, so I don't know if it was a sting operation or...
One of the things too, and when you're asking me why north and northeast, is there's some areas, and it's not just north and northeast, there's some other areas, but I think that it's fair to say that when you have a certain, like for example, I mean, when we drive through our neighborhoods, I mean, almost when you cross the street, things change. You know, from neighborhood to neighborhood. Have you seen that? So it's sort of, that's why we say it's a public health issue. It's infectious. So when you have one crack house in one block, you're likely to have more than one. Having to do with what epidemic is, what it really means. Just for example, if I have, let's use like the flu, and it's really highly contagious, and I come to work with the flu, the number of people that I touch with that, just, right?
It's that broken window theory, too,
That, exactly,
right?
that's what he's saying. What he did was, what this one person did was that they, for example, the numbers that we're seeing in downtown, there's a lot of that happens, and this place transforms into that 7 o'clock at night. So you all see that. I mean, you're walking down the street going movies. And see that. So there's some of that stuff. But the other thing too is that, for example, property crimes are higher in some parts of the county than others. I think car thefts are real high. Or car,
where the gang incidents were, where the crack houses were, and where the CSD, there's no services, there's no infrastructure.
Okay.
Okay, well, back to death in the hood, how has social service providers dealt with the impact, especially in an area where the map is dark? And could you preface your statements by saying, we at blah, blah, blah have dealt with the issue by blah, blah, blah?
The staff at the North Portland Youth and Family Center, which is a project of DeLaunay Family of Services, came to the shocking, and it was a shock at the time, realization that they had to deal with the issue of death in the hood, children killing each other, in 1988 when the first drive-by fatality happened in Columbia Villa. Before that, we knew the violence was out there, but that kind of crystallized things, and at that point in time, staff realized that they were in a war zone. And in some ways, it was kind of a shock and an awakening. And after that, staff began looking at clients and their time, kids and their families, knowing that we are a very limited resource in terms of where can I give that extra hour I have on Thursday? What kid has the most chance of benefiting from that? And, you know, because we felt very, very overwhelmed at that time. In a lot of ways, that kind of attitude hasn't changed, but what we've realized since then, as we continue to give that extra effort to kids and families wherever and however we can, that you don't always know what your result's going to be. There have been kids in the last year or so that I've heard about that we worked with back in the early or the late 80s, who my staff frankly thought would never make it, and who are around today. Just the other day, Bob Bernstein, the diversion coordinator at North, walked into a local fast food place and had a young man introduce him to his friends who he had worked with a couple of years ago, and he introduced Bob as, this is the man that saved my life. And this is a kid Bob didn't think was going to make it, and he did. So you never know. There's a lot of talk about high-risk kids and the amount of resources that it takes to work with them, and that there's no hope for them. And I say nobody really knows that. And you can look and find studies to prove anything you want to prove to back up whatever your budget decisions are. That's just a matter of research. I think the truth is, when you connect with kids, you don't know which ones are going to make it or which ones aren't. You don't know if a little will do it or a lot will do it. You do what you need to do, what your feelings tell you you need to do, and you hope for the best.
You know, Portland dealt with this issue with a combination of prevention in the area of social service, as well as detention and punitive in the area of juvenile court. Now, in the area of social service, we see money being rescinded and the allocation of funds being directed toward other issues. How do you think that will impact the future assaults and violence in this neighborhood?
I've been aware since about 1990 of a gradual draining away of resources from that part of the world some of us call the corridor, which is the I-5 freeway that cuts through and is the actual service boundary between North and Northeast Portland. I've seen maps of crack houses and gang incidents and permanent placements for CSD of that area, and it's a solid mass, whichever map you look at. As resources drain away from that area, because other areas are now experiencing, especially the gang problem and the gang phenomena, they're taking the resources away from the corridor and moving them elsewhere, in part because you have people elsewhere, there's larger population numbers that can be used to back up changing of funding formulas. That doesn't make things change. It doesn't mean things have gotten better in that corridor. It's still a dangerous place. It's still a place where you need a lot of services, and prevention is very important, but so is intervention. You have to have a continuum of services for the kids that are out there. As money drains away from this area, the reality is things will become worse unless another kind of economic factor kicks in, and that's as property taxes rise, both in North and Northeast Portland, you will see gentrification take effect, and actually the populations that family centers like mine and the one in Northeast have to work with, perhaps in 10 to 15 years will look very different, because the people who live there now will have been taxed, their taxes will have gotten so high that the fixed income levels they're at or the lower income scales won't be able to afford to remain there. Does that hit all your points?
Hit all, but in looking at this violence, youth violence, we also had to talk about the rise in domestic violence and child abuse. Could you focus on why is there a rise of those two?
Well, I question whether it's a rise or more awareness. There was a time when people didn't talk about sex abuse, and certainly people didn't, except maybe in whispers, and certainly it wasn't reported like it is today. So I really don't think the amount of sex abuse has really changed. I think people are reporting it more. So it feels like there's more. And I think that's also true of domestic violence. As people are more educated, particularly people who are in the fear end of that, women and children, and they reveal the situations they're living in and seek help, it just feels like there's more. We really don't know if there is or not, because we don't know what was there before that was hidden and only whispered about.
Where do you see this issue evolving into in the year 2000 when you're no longer here?
The violence?
The violence. You see it escalating, because right now it's flat.
I think a lot of it depends on the economy and what we do with education. I think education has to make a major paradigm shift in terms of really educating our children to be self-sufficient and supportive and truly educated. Unless those things happen, and unless we reach into those communities where education is not perhaps valued as it should be, and unless that changes, you're going to have a subculture really of very poor people who will be very desperate and probably many of them homeless, and their options will be to rob the rest of us or be in jail. And keeping people in jail, I think we're looking at heading that direction, and it's an extremely expensive direction to head in. I heard a statistic a couple weeks ago that it costs $40,000 to house a kid for a year in the juvenile justice system, and that's what it costs to educate someone for 4 years at Harvard. And I think our taxpayer dollars would be better spent taking these kids and sending them to Harvard, at least at the end of 4 years instead of just one. They'd have a pretty interesting degree.
Yeah, but can you appreciate taxpayers who are tired of the violence? I mean, the level
Oh,
of
sure.
fear in this neighborhood has escalated. Why should I have trouble sending my kid to college? Why should I send a petty criminal to college?
It isn't so much that you're sending them, but right now what you're paying for is to keep them locked up, and at the other end of that process, what you have is someone who is a more educated criminal in criminal behaviors. I mean, you're spending the money now. It's a matter of where you put it to spend it. It's a way to, that's how much it costs to keep one kid locked up for a year. We're locking more and more kids up. Measure 11 will lock them up for a very long time. When you think about it, just do the math. It's extremely expensive. It would make a lot more sense to put that kind of dollars one way or another into education, into developing some hope for these kids, because at least some of what I've seen among the kids, they don't know how to get to that place where they see if you're one of the people in the majority of the society or the mainstream of American society. They lack the steps on how to get there. They don't think they can get there. And unless we show them the way through education and social services, they're going to take another route. And we're going to pay for it one way or another. It's cheaper. Prevention is cheaper. Are we done?
Yeah.